Hello, I'm Dr. Uma. I'm one of the doctors here in the clinic today. What would you like to be called as?
Hi, you could call me Marina.
Marina, I'm aware that you were here to see my consultant, but they couldn't be here. I've gone through your reports, and if you allow me, I could do the consultation for you. We can also have a separate appointment for you later.
Okay, that's fine.
Okay. So I understand you are here to know more about your test results. May I ask a couple of questions so that we can make a safe management plan for you?
Okay.
Are you currently having any complaints?
No, I don't.
Why was this particular test offered to you? Anything explained before doing the test?
Actually, my mother had cancer when I was a kid, and she died of breast cancer. And then now recently, my sister has been diagnosed with cancer at the age of 40, breast cancer, and she's detected to have the gene that, the cancer gene.
Oh,
Hence,
okay. I can see that you're very anxious. I'm sorry to hear about your mother and your sister. How is your sister holding up now?
she's okay, or she's under treatment.
Mhm. Okay. But I just have a few more questions and then we can go to discuss your reports. Is that okay?
Okay.
Thank you. Yes. Are you facing any bloating or any tummy ache?
No,
Any weight loss?
no,
Any loss of appetite?
no,
Mhm. Any breast lump?
no.
Have you done your pap smears?
Yes, they are normal.
Okay. And any screening mammographies?
No,
Are
not
you
that.
married or in a relationship?
I'm married.
Okay. Any pregnancies in the past?
Yeah, I have two girls. The elder one is 8-year-old and the younger one is 6, and they were both born vaginally.
Oh, okay. And have you completed family or you want more kids?
I have completed.
Okay. Could you tell me more about your periods?
They're regular. The last period was 10 days ago.
Mhm. And do you see your GP for any medical problems?
No,
Currently on any medications?
no.
Any contraception do you use at all?
Condoms we use.
Mhm. And if you don't mind me asking, do you smoke?
No, I don't.
Drink alcohol?
No,
Any recreational drug?
no,
Do you have any allergies?
no.
Are you well supported at home?
Yes, by my husband.
Mhm. And what do you do for a living? Do
I'm a homemaker.
you know your weight for height ratio?
Oh, yes, that's 35.
Okay. And your blood group?
Be positive.
Any reservations for transfusion?
No.
Do you have any other siblings apart from your sister?
No other siblings. No.
And any aunts or uncles from the maternal side?
No, my mother was the only child.
Okay. Thank you for all this information. Is there anything in particular you want me to address first?
Oh, no, I just want to know the report actually.
Yes, I have a lot of information to give you. Some of it may be concerning. Do you want someone to be with you before I discuss?
No, I'm alone, doctor. You can tell me.
Marina, I'm sorry to have to say that you have tested positive for the BRCA1 gene. Do you know what that means?
Oh, does that mean I have cancer?
No, not really. In general, women have a 12 in 100 chance of breast cancer and a 1 in 80 chance of ovarian cancer in their lifetime. But women with the
Uh-huh.
BRCA1 mutation, they have a greatly increased chance of cancer in the ovary and the breast. This can be up to 40 to 60 of 100 women with ovarian cancer and between 60 to 90 of 100 developing breast cancer at some point in their life. I'm not trying to scare
Okay.
you, but I must give you all the information so that you make the best decision. Okay?
Right.
So it doesn't
Hmm.
mean that you have cancer or are definitely going to develop it, but when you do, they may tend to be at a younger age group, a little more aggressive, and there is a chance of cancer occurring again later as well.
Okay.
All right.
Right.
So about this, we have two approaches for prevention. So you can either
Okay.
choose to have cancer screening, you can choose to have risk reducing surgery to remove breast tissues and ovaries and the tubes as well before the diagnosis of cancer. Would you like me to elaborate?
Yes, sure.
With the screening, usually provided by our breast cancer screening program, a yearly mammography or MRI starting from the age of 30 will be offered. This doesn't reduce the chance of cancer, but we can try to detect early stages so it's easier to treat. And you must also feel for a lump yourself at least once a month and report urgently if you find any. The other option, removing the breast, will reduce the risk of cancer to less than 5 in 100 chance, yet not completely eliminate it. But it is a major operation, involves risks which may be higher in your case due to your high body weight ratio and risk of anesthesia, pain, infection, bleeding. Also, may cause some sexual or psychological problems. Of course, we can put you in touch with counselors for the same.
All right.
Mhm.
Okay.
The other operation involves removing both the ovaries and the tube via keyhole operation, offered from the age of 35. This alone reduces risk of breast cancer by about half and ovarian cancer by 95%. Also
Hmm.
prolongs the survival and reduces death rates by 70%, even in women who have had breast cancer. But still, there will be a 1 in 100 chance of cancer arising from the lining of the tummy. And as with all surgery, it will involve risks to injury of internal organs, pain, infection, bleeding, anesthesia, especially higher in your case, again, due to the high body mass index. Hmm?
Okay.
Also, I must inform you that the ovaries produce estrogen that protects the brain, heart, and bone. And the lack of estrogen can cause urinary, memory-related, or sexual problems like reduced libido and dryness. So, after the surgery, this is supplemented till the natural age of menopause around 51 with estrogen. However, in
Hmm.
order to protect the womb from harmful effects of estrogen alone and resulting risk of thickening and cancer of the lining of the womb, we may add progesterone. This combination can in turn increase chance of breast cancer. Hence, some women choose to have their womb removed as well during this time. And after this, estrogen only hormone replacement is safer. But
Okay.
it may be at a higher risk due to again your BMI, the complications like clots in the legs with HRT as well. Hmm.
Okay.
I must also inform you that doing risk reducing surgeries for breast and ovary, there is a small chance of finding cancer present at that time in the breast or ovaries, likely in its early stages, and we will offer an ultrasound and CA-125 before the surgery.
Oh,
Any question?
doctor, but are there any other preventive strategies or any screening methods that you can think of? I mean, you can do.
Unfortunately, there is no reliable screening for cancer of the ovary. However, if women choose not to have the removal, then yearly ultrasound could be done. There are some
Uh-huh.
other strategies. We advise to keep your weight under check, not smoke, have a nutritious diet, exercise. Having a high weight to height ratio is a risk factor for breast and uterine cancers. Also increases adverse effect of hormonal therapy. Use of oral contraceptive pill has shown to reduce risk of ovarian, and tamoxifen, raloxifene are drugs which can reduce risk of breast cancer, but they have their own risks, side effects, especially given your weight for height ratio, and they cannot completely remove the chance of cancer. Hmm?
Okay.
But you will be cared for by a multidisciplinary team. Our consultant, psychological counselors, surgeons, geneticists, gynecologists will decide the best way ahead. We'll put you in touch with counselors and support groups to help you deal with these trying times. I must also tell you that there is a 1 in 2 chance of passing this gene onward to your daughters. They can have
Oh,
to have their test as well for the same. The team will help
okay.
you through talking to your kids about this. Let me give you some
All
written
right.
information about this. I will discuss with my consultant. Is there anything else I can help you with?
No, doctor, thank you for all that information.
Thank you so much, Marina.
Thank you.